Lauren Thomas, and this is my recorded clinical ABC health assessment. I'm going to start with an environmental scan. Ignore my messy house. And for today, this gentleman will be my simulated patient. Could you please state your full name and whether or not you consent to this recording?
Derek W. and I consent.
Your real name.
Real name?
Your real name for this consent.
Oh, Matthew Dalsma, and I consent to this.
Perfect. Okay, so we're gonna start. Just gonna make sure I have my supplies here. It's just a ruler and just a flat card. The writing is just a certification. So, okay, you ready?
Yep.
Okay. Hi there, my name is Lauren. I'll be your nurse for today.
Okay.
Before we start, could you just tell me your full name and your date of birth?
Derek W. and I'm born on September 8th, 1991.
Perfect. Okay. What brings you in today, Derek?
A little bit of shortness of breath and a cough.
Okay.
For about a week it's been.
For about a week. Okay. Do you or your family have any history of respiratory illness?
No.
Okay. Are you currently taking any medications?
No.
Do you have any allergies?
No.
Okay. So before we start, I'm going to explain everything that I'm doing today. I'm going to be doing a focus assessment of your respiratory system and of your cardiac system. If at any point you have any questions, feel free to just ask. And if you feel uncomfortable at any point and you'd like to take a break, just let me know and we'll stop. And you can take as long as you need. Okay?
Sounds good.
Okay. So starting my ABC assessment, we're going to start with the A, airway across the room. I can tell that Derek here has a patent airway. He's talking and answering all of my questions. And he doesn't sound like he's choking or has something stuck in his throat, so I would consider that a patent airway. Next, we're going to do vital signs. So for the purpose of today's assessment, Derek here, his vital signs are a blood pressure of 130 on 94. He's got a heart rate of 88 beats per minute. He has a respiratory rate of 20 resps per minute. His oxygen saturation is 95% on room air, and his temperature for today is 36.7 degrees Celsius. Okay, so the first thing I'm going to start with is your breathing assessment, the B in ABC. So, Derek, you said you've had this shortness of breath and cough for about a week, correct?
Yeah.
Okay. Are you coughing anything up?
No.
Okay. Does your cough feel more like a hoarse, dry cough or a wet, congested cough?
It's a little dry.
A dry. Does it hurt to cough?
A little bit.
A little bit, okay. Do you feel any nasal congestion?
Nope.
Okay. Any wheezes that you've noticed?
Nope.
Any sinus pain or pressure?
No.
Okay. Are you experiencing any chest pain?
A little bit, not much.
Okay. Currently or on and off?
On and off.
Okay. Any flu-like symptoms? Runny nose, headache, upset stomach?
Nope.
Okay. So on a scale of 1 to 10, 1 being the least and 10 being the worst here today compared to your normal, how short of breath do you feel right now?
3.
A 3? Okay. All right. And you said no one in your family has any history of respiratory illness?
Nope.
And you yourself have none either? Okay. So the first thing I'm going to do is I'm going to inspect Derek's chest here, do his inspection of his respiratory system. So I can see here that he seems to have symmetrical breathing. I do notice that he's a little tripoded, so he's got some increased work of breathing, but I don't see any, sorry, I'm just going to get you to lift your head. I don't see any nasal flaring or any retractions, and I definitely don't hear any stridor, so those are all good signs. He has good level of consciousness. I don't see any pallor or cyanosis in his mucous membranes or in his fingertips. Can you just show the camera your fingertips? Other side. Perfect. But you do have the cough and the shortness of breath.
Yeah.
Does it hurt? I already asked that, sorry. When you're walking around, do you feel more short of breath?
Yeah.
Yeah, okay. So shortness of breath on exertion. I'm gonna see if his chest seems even. He does seem to have a little bit more effort, but otherwise his respiratory seems regular. His respiratory rate seems regular and not shallow, so that's a good sign. So the next thing I'm going to do here is I'm going to do some palpation of your anterior chest. Sorry. So I'm just going to feel with the pads of my fingertips here for any subcutaneous air trapping. Good. Okay, and I don't feel any, so that's a good sign. So the next thing I'm going to do is to assess for tactile phragmitis. What that is that I'm going to use the side of my hand here, and I'm going to have you say a word, and I'm going to feel for the vibrations of your words, okay? So when you feel my hand on your chest here, I'm going to have you say the word 99. Ready? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. So the vibrations are present and symmetrical bilaterally. That is a normal finding. I'm going to have you turn around here, Derek, and face your back to the camera. All the way around. Sorry. Perfect. And we're going to do the same thing for tactile phragmitis. So again, when you feel my hand, please say the words 99, okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay, so again, present and symmetrical bilaterally. That is a normal finding. So the next thing I'm going to do in my palpation assessment is I'm going to assess for symmetrical lung expansion. So I'm going to put my thumbs here. I'm going to try and get a good angle for the camera. Kind of about the 10th rib here. Matt, I'm just going to get you to, or sorry, Derek, I'm going to get you to sit up straight for me. Okay, I'm going to put my thumbs at about the 10th rib, and I'm going to fan my hands out laterally, and then I'm going to push my thumbs in medially to get a bit of the skin. And then whenever you're ready, Derek, I'm going to get you to take a deep breath for me. Perfect, and back out. Perfect. So as you can see, my hands moved equally and symmetrically on both sides, so that indicates to me that he does have symmetrical lung expansion. Derek, I'm going to get you to turn and face the camera again, and we're going to listen to your chest this time. So I'm going to use the bell of my stethoscope here, or not the bell, the diaphragm, sorry, of my stethoscope. And again, when you feel my stethoscope, I'm going to have you take a deep breath, okay? I'm going to use a ladder approach, and I'm going to start above the clavicle here to listen to the apex of the lungs. And then I'm going to move in between the ribs to the intercostal so I can properly hear. For the purpose of the assessment, we do have clothes on, but typically I would do this without any clothes. Okay, perfect. So I'm going to get you to turn your back to the camera again, and I'm going to listen to the posterior chest this time. In the anterior chest, I heard more tracheal sounds and then bronchovesicular sounds the lower I got. Both of those are a normal finding. I didn't hear any adventitious sounds, and you have equal air entry bilaterally. Okay? So I'm going to go again on the posterior chest. Same thing, when you feel my stethoscope, take a deep breath, okay? I'm going to have you sit straight up for this. Okay. So I'm going to start again at the apex. And I'm trying to avoid the scapula here so I can actually hear the lung sounds. Derek, I'm going to get you to hold your arms straight out like this in front of you, and I'm going to listen to your lateral chest. So on the left here, you only have 2 lobes because your heart is taking place of the middle lobe. So I'm going to listen up top here, deep breath, and down here. Perfect. Okay, and then on the right here, I'm going to listen in 3 spots so I can accurately hear all lobes. So just below the armpit, and in at the middle, and near your lat muscle. Good. Okay, you can relax. Okay, so I did hear equal air entry bilaterally, which is a normal finding. However, I did hear some fine crackles to the right lower lobe of the lung. Sometimes that means that there is some fluid or mucus, what we call consolidation in the lung. So I'm going to do a further assessment here, Derek, if that's okay with you. So I'm going to do what's called a vocal stimulation test. This one's called bronchophony. So I'm going to get you to say the words 99 when you feel my stethoscope, okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. So I did hear muffled sounds throughout, except in the right lower lobe. So that does indicate to me that there may be some consolidation. So we're going to pass that along for the doctor so that we can properly assess and treat. Okay?
Yep.
Okay.
Thank you.
So the next thing I'm going to do, you can face the camera again. We're done with our respiratory assessment. I'm going to start my cardiac assessment, okay? So we're going to start with a subjective assessment again. You said you were having some on and off chest pain. Can you tell me what makes the chest pain worse or better?
Exertion makes it worse.
Okay. Does it hurt when you take a deep breath in?
And the cold air too, a bit.
Okay. What about when you take a deep breath in?
Yeah, more the inhale.
Okay, more inhale than exhale. Okay. What descriptor would you use to describe the pain? What word?
It's dull.
Dull. Okay, does it ache or is it tight at all?
It's kind of achy and it's lower too.
Lower. Okay, can you point
Low
exactly
down
to where? Okay, more towards your diaphragm?
Yeah.
Okay, nothing in your central chest?
Nope.
No heart pain?
Nope.
Okay. Does the pain radiate anywhere throughout your chest? So it just stays the same. Okay. So on a scale of 1 to 10, we're going to assess for severity here. 1 being the least and 10 being the worst pain of your life. What number would you give your chest pain?
Probably a 3.
A 3. Okay. Okay. So again, we're going to move into a subjective assessment. So you do have shortness of breath, some increased work of breathing, and a cough. Do you feel any fluttering or heart palpitations in your chest?
No.
No. Okay, so that's a good sign. That means that you probably don't have an arrhythmia that's underlying, so that's good. Again, I don't see any cyanosis or pallor. Any lightheadedness or dizziness? Any increased sweating? Okay. Have you noticed that your legs, ankles, or feet have been increasingly swollen?
No.
Okay, good. Okay. So I'm gonna get you to sit up here on the table. We're gonna use the table for this exercise, and just lay on the table here. All right. You comfortable?
Yep.
Okay. So I'm gonna start my actual assessment of your cardiac system, okay? My objective assessment. So I'm just gonna get you to put your hands down at your sides. First thing I'm going to do is inspect his jugular vein here. So I'm gonna use my flat card and my measuring tape to properly assess his jugular. We wanna look for the point of maximum impulse. So Derek's here is right about here. And I'm gonna compare that to the suprasternal notch and do a measurement. So I want to find the point of maximum, which is where my index finger is. And then I'm going to use my little ruler and I'm going to measure against my suprasternal notch. So Matthew's here is 3 centimeters. That is a normal finding. Anything under 3 centimeters is considered normal. So the next thing I'm going to do, just hands at your sides, is to assess his carotid veins, his carotid arteries, my apologies. So I'm going to start by auscultation and then palpation. Auscultation, I'm going to start with my diaphragm and then my bell, and I'm going to listen bilaterally, so to both sides. So I'm going to start here, and you just relax, okay? Okay. And I'm going to flip it and listen to my bell now, with my bell, sorry. Okay, so I don't hear any bruise, which is a good sign. It's a normal finding. I'm just going to feel in here. I don't want to feel too high because sometimes if you massage the carotid, you can obstruct blood flow to the brain. So I'm just going to feel a little lower, making sure I move that muscle out of the way, always with at least 2 fingers. Good, and we're going to go the other side. Good. So a regular rate, strong pulse. It's not bounding, it's not thready, and I don't feel any thrills, so that's a good sign. So the next thing I'm going to do here is I'm going to inspect your chest, your trunk area. So I don't overtly see any ventricular pulsations popping out at me. That is a normal finding. If I was to find one of those, I would have to chart that and notify the MRP. I don't overtly see any masses either in his trunk, so that's a good sign. So I'm going to start with palpation here. I don't know if this is a better way for the camera. So I'm going to measure down to the second intercostal, right of the sternal border here. And I'm going to feel, this is where your aortic valve is. And then I'm going to move along over to the second intercostal left of the sternal border for your pulmonic valve. And then down to the third intercostal, the fourth intercostal, and the fifth intercostal. Perfect. The fifth intercostal here is your tricuspid valve. And then I'm going to move over to the mid-clavicular line. This is your mitral valve. It's also the apex of your heart, and it's the point of maximum impulse. So I just want to make sure that I can feel the point of maximum impulse, and I can. Nothing here is, there are no thrills and no heaves, so that again is a normal finding, it's a good sign, and I can feel your maximum impulse. The next thing I'm going to do is auscultate your chest. So I'm going to do the same thing here, but with my stethoscope. I'm going to flip back to my diaphragm, and then I'm going to use my bell afterwards. Do you want your arms above your chest or below?
No, I'm good.
Okay, I'm going to get your hands down at your sides. We're almost done. So I'm going to move 1, 2, second intercostal. Right of the sternal border. Here I can identify lub dub. Dub is louder, which is a normal finding. S2 is louder at the base of the heart. I'm going to move along here to the second intercostal left of the sternal border. Perfect. And here I can identify lub dub again. Again, the dub sound is louder. That again is a normal finding. I'm going to move down second, third, fourth, fifth to the fifth intercostal here. This is left of the sternal border. This is my tricuspid valve. Here I can identify lub dub, and the lub is louder, which is a normal finding. And then I'm going to move to my mid-clavicular line over here to my apex. And again, I can identify lub dub, and the lub is louder this time. That is a normal finding for S1 at the apex of the heart. So considering this is your apical pulse, I am going to listen for a full minute. Perfect. So he does have an apical heart rate of 88 beats per minute. That is a normal finding, and that is comparable to our vital signs. So the last few things I'm going to do here is I'm going to assess his peripheral pulses. So I'm going to feel that his arms are both, I'm going to take that arm, warm and dry. I'm going to feel for his radial pulses, if you could just lift that arm there. Perfect, strong, regular, and equal bilaterally, and then I'm going to feel for his brachial pulses. Good, strong, equal, and regular bilaterally. Okay, I'm going to move along to the popliteal pulse. So I have to put both fingers under my patient's knee and kind of feel in. This one's very difficult to feel. Good. And moving along to the other one here. Good. Both regular, strong, and equal bilaterally. The posterior tibialis, I don't know if the camera can see me, it's just in here on the inner side of the ankle. Perfect. Regular, strong, and equal bilaterally. And then our pedal pulse. Regular, strong, and equal bilaterally. The last thing I'm going to do here, Derek, is an assessment called Ullman's sign. Ullman's sign assesses for a possible DVT or deep vein thrombosis. So I'm going to take your foot here, and I'm going to do a dorsiflexion, and then I'm going to grab your calf and squeeze. Do you feel any calf pain?
It's tight.
Any pain?
Not pain, but it's not nice.
Okay. It's not supposed to be comfortable. And I'm going to do the same thing with the right foot here. Pain?
It's not as bad.
No? Okay. So that's a good sign. That means that there's likely not a DVT or deep vein thrombosis in your legs. In summary, I'm going to have you can sit at the edge of the table here now. I just want to confirm, before you get off the chair, I just want to confirm that the camera knew where I was landmarking for my heart sounds. So second intercostal, right of the sternal border is my aortic valve. Second intercostal, left of the sternal border is my pulmonic valve. 3, 4, 5. Fifth intercostal, left of the sternal border is my tricuspid valve. And then mid-clavicular line, fifth intercostal, is my apical rate, or apical pulse, and my mitral valve, the apex of the heart. So in summary, today we discussed shortness of breath and cough. We've got a 3 out of 10 shortness of breath and 3 out of 10 occasional chest pain. I'm going to pass these information on to the doctor. Your chest does sound, you have equal air entry bilaterally, but you do have the fine crackles on the right lower lobe. So he's probably going to get a chest x-ray for you. And then as far as your on and off chest pain or intermittent chest pain, I think that we should probably do a CBC and some lights, some blood work for you, just to see if there's anything out of the ordinary, and perhaps get an ECG of your heart. Does that sound okay?
That sounds good.
Perfect. Thank you.